Today, we are reporting 1,133 cases of COVID-19 in our community, an increase of 13 cases from yesterday. 8 people work in the agri-farm sector and 5 people are under investigation at this time. 676 cases have resolved. 4 people are in the hospital. 20% of our total cases are between the ages of 20 and 29, 19% are between the ages of 30 and 39, and 16% of our cases are between the ages of 40 and 49. 53% of our total cases are male and 46% are female, and 1% is unknown at this time. Our community has lost a total of 67 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There is currently 1 long-term care home experiencing a COVID-19 outbreak. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alet Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for the Epi Summary Report.
Good morning, everyone, and thank you for joining us again for our Epi update. Building up to what Teresa just mentioned in terms of the efforts that our staff put in to make the drive-through testing happen, I just want to thank each and every one of them and all our partners to make all these things happen in such a time period. It's their dedication and commitment to serve the community to make things happen, especially when it's needed. And today is our last day of random testing through drive-through testing. The logistic of arranging this drive-through testing was a monumental task, and I want to thank all the residents of Windsor-Essex County to make it a success. We've already completed almost 4,500 tests using our drive-through model, which is roughly 25 to 30% of the entire test that happened in our region. Every day when we are making decisions and recommendations in the interest of the public, we always consider the safety and well-being of everyone. This week we announced that we will begin to declare outbreaks for all workplaces where there are 2 or more cases within a reasonable timeline to suspect transmission in the workplace. In making that decision, we carefully looked at the risks to public health, workplaces that are open to public, and the unintended consequences of the decision. Based on the careful review, we will be posting the sector of the outbreak and the number of outbreaks for each sector, but we will not publicly disclose the name of the workplace unless there is a direct risk to the health of the general public that warrants public notification, legal obligation to release the name, and or the workplace that is accessed and is open to general public. The focus of each and every recommendation we make is to ensure that the recommendation is made in the best interest of the entire community. Public health priorities throughout this entire pandemic is to save lives, reduce the risk of transmission, protect the healthcare system, and prevent any societal and economic impacts of COVID-19. Every decision we make is based on these principles, and every decision is reviewed regularly, keeping these principles in mind and the best practices that are currently available. Second thing I want to talk about is the social gatherings, which have now been increased to 10% from 5 starting today. This is good news for people in our community who might be missing friends and family, and provide some alleviation from the isolation we have all been feeling. I ask that we all continue to act and behave with caution and continue to follow public health guidelines. To protect yourself and others in the community and family or friends, you may connect with, I still want to remind all residents to continue to maintain physical distancing of 2 meters from each other. Wash your hands with soap and water regularly, or sanitize with alcohol-based hand sanitizer. Stay home and away from others if you're sick, and contact your healthcare provider. Wear a non-medical mask in public setting where physical distancing is not possible. We have received a number of complaints recently about crowds and gatherings. I know it has been a long time, but we must continue to practice public health measures if we want to protect our community and limit the spread of COVID-19 and enjoy some of these outings and some of these gatherings publicly. I will now move on to our weekly epidemiological summary. And this is what we will cover in our presentation. I'll focus on the key points to answer many of the questions that we ask every day and a question that was asked of every day. The conclusion we draw based on these data is help us in making evidence-based decision to make recommendations for our public. The epidemic curve or epi curve help us assess the progression of the disease, whether in the community or in an outbreak situation. This particular epi curve is created to show the number of confirmed cases by symptom onset date. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the date these cases started showing symptoms. The significance of using symptom onset date instead of the case reported date is to get a sense of when the disease transmission or exposure happened. This includes all cases, that is community cases, cases in the long-term care home and retirement home, healthcare workers, and cases in the agricultural industry. Please note that the data presented in the shaded area may not be reported yet to public health and may not be entirely accurate and subject to change. Day-to-day variation can vary significantly, and we know COVID-19 do not cause diseases after exposure immediately. It could take up to 14 days to show symptoms. And in order to minimize the impact of day-to-day variation, another way to look at the epi curve is to use a 3-day moving average. The 3-day moving average should capture day-to-day variation and will try to paint a much better picture when the transmission and infection is happening. We can see that roughly since second or third week of April, the number of confirmed cases started to go down and was moving in the right direction. In the early May, we noticed further decline in the number of cases. We then now are seeing a surge in the number of cases, especially in the second and third week of May, and still continuing to show some of those evidence even in, as recent as last few days. Please note that the shaded area on the right is may not be reported to us yet, but we can see that some of the cases that we are seeing are more recent and are all linked to agri-farm industry. To present a much clearer picture, this further breaks down the cases by long-term care home and retirement homes, including the healthcare workers and those working in the agricultural farm industry and everyone else in the first two groups. You can see a spike in the last in the month of May among those working in the agricultural farm industry, which is represented by the mustard yellow color graph on your right-hand side. But please note again, the shaded area may still be investigated right now and may not be yet reported to public health. Overall, we can see the long-term care home and retirement home accounts for 27% of our cases, which roughly equates to 299 cases in total to date. As of June 10th, we currently have 280 cases that are workers in the agricultural farm industry, making up 25% of our overall cases to date. The next question that we want to answer, that how are we comparing with the rest of the province and the rest of the regions. Windsor-Essex has the 4th highest rate in the province, and our rates are higher than the provincial average. We have seen an increase in Haldimand-Norfolk region, which pushed us down to number 4th. Windsor-Essex is much closer in terms of its rate with Durham and York compared to Peel region, Haldimand-Norfolk, and Toronto. We are still higher than the provincial average. For us locally, we have experienced a higher proportion of cases in three particular segments. One was resulting from the essential travelers crossing borders that caused our first surge of cases in our community, which was then which was then translated into the long-term care home and retirement home, where we saw a second surge in our cases in our community. Recognizing that the border crossing people going to work in Michigan is significantly higher than the province, our region is significantly high number of people who are traveling, crossing border every day. And on the same note, the long-term care home and retirement home numbers, they are significantly higher in Windsor-Essex compared to the rest of the province. So those are the two reasons that we have seen those two surge. Now the third surge we are seeing is in the agriculture farm industry, which is also among one of the highest in the province. We have roughly around 8,000 to 10,000 agri-farm temporary foreign workers who are coming in the region and working for us. And those are the three reasons that are driving the numbers up for our region. Our weekly epidemiology team has noticed a shift in the cases over the past month or so. Here we are looking at the overall cases by age and sex and what that looks like in the past 2 weeks. Overall, we have seen slightly more male compared to female, but the number is disproportionately high in males within the past 2 weeks. When it comes to age, we are seeing a high number of cases among the 20 to 39 years old in the past 2 weeks, and low number of cases in the older age groups. However, overall, about 14% of our cases were 80 years or older, and many of them were residents of long-term care home and retirement home. Next slide. So now we're presenting another age and sex distribution of workers who are working in the agri-farm industry. And when we are looking at it, these are disproportionately high number of cases that are in male compared to female, and most of them are among the working age between the ages of 20 and 49. This graph shows the distribution of COVID-19 cases by municipality, and this represents the overall cases, the cumulative cases right from the beginning up until today. Currently, just under 50% of our cases are from Windsor, and the rest are from county. We are seeing almost 30% of our cases from Leamington, and this is due to the uptake in cases in the agri-farm sector, where most of these farms are located. Significant difference in number of cases in some of the municipalities due to the high number of positive cases in the long-term care homes and retirement home. But I would still caution everyone to interpret this graph very carefully, because irrespective of where you live, the COVID-19 does not differentiate, does not follow the boundaries. So anywhere in the region, when you are there, you have to take all the same precaution that you would take, whether you live in Windsor, whether you live in Essex, whether you live in Leamington. All the places you must have to take the same precautions. Switching to some of the things that happened recently in the last 30 days. So looking at the past 30 days tells us a different story. Over 70% of our cases are from Leamington area, and 17% are from Windsor. There are cases, however, across all the county in some capacity, and that's why we're going back to the same message. We cannot say one area is better than the other. Everyone needs to take the same precautions to keep themselves safe, keep their families safe, and keep their community safe. So the next graph shows the exposure date, history by reported date, and the possible mode of transmission. And we have divided it into travel-related transmission, close contact, and the community transmission, which is of interest from a community spread perspective and the risk to the community in general. Through the extensive case and contact management, the health unit, we were able to identify the majority of the exposures as close contacts. So basically, when we are identifying all these close contacts in a timely manner, we are preventing many of the further transmission or secondary transmission from these contacts, and that's why we are seeing a decline in the number of cases in the community, except for some places which are at a higher risk of spreading based on their living conditions, based on this industry or sector that they're working in. This shows the impact, sorry, can you go back to the slide? Yeah, so this graph also shows the impact of our measures. If we can track down most of the cases to a close contacts, that means we are reducing the community transmission. And if you look at the cases in the past few weeks or about a month, most of these cases are happening in the close contacts. Next slide, please. This slide looks at the exposure of agri-farm workers in the past 30 days. Again, this is just to give a better picture of what has happened in the last 30 days with respect to this population. And we're looking at it, majority of these cases have primarily acquired the illness through close contacts. And we know most of these close contacts are happening in their accommodation settings and not necessarily through their workplace or through other settings. It is also important to know that some of these transmissions are initially originating from the community exposure, and then after that community exposure, this has been coming back into the accommodation and spreading it to other. We know that most of these workers are mobile, and they are just like any other industry, nothing different, and they are interacting with the community, and that's why it is important for everyone in the region to take appropriate precautions, appropriate step to ensure that they are not coming in contact with anyone and spreading the COVID-19 to anyone else in the community. So looking further into the COVID-19 by healthcare worker status, we can see that around 21% of our cases in our community were in a healthcare worker, and of these cases, a significant number of healthcare workers have traveled to Michigan when they acquired COVID-19. About 5% of the cases visited a healthcare facility before getting infected. This highlights the importance of infection prevention and control guidelines in many of these settings, especially the healthcare settings. Another question that is frequently asked is if the cases had any underlying chronic conditions. About 34% of the cases had some medical condition where it was chronic, underlying, or if they were immunocompromised. But there's a significant number, more than 2/3 of the cases, do not report any underlying health conditions. A quick look at what cases and what symptoms they are reporting. 72% of our cases had some type of cough, either new, worsening, or productive cough. But please note that many of these case reports more than one symptoms, and that's why these numbers may not add up. So looking at our health system capacity, this figure shows the number of COVID hospitalization and the patients in ICU on a given day. And just a word of caution, all these numbers can show either new cases as well as existing patient with COVID-19 in the hospital and ICU setting. Cases in the ICU remains relatively low and has stabilized to one case only. The red line include the 7-day moving average in the ICU, showing a decrease, which essentially means a positive trend in the ICU settings. Hospitalizations have fluctuated more than so the ICU, and we have seen a sharp decline in the number of inpatient hospitalization in the past week or so across our region. Further breaking it down in terms of the capacity of our healthcare system, the orange line highlights the occupancy rate, overall occupancy rate. It's not just with COVID, it's for any reason that any of these individuals are staying in the hospital or in the ICU. The orange line highlights the occupancy of our acute care beds. The threshold for that is to have the occupancy rate below 85%, which we are currently meeting. This signals that we are currently able to meet the demands if it increases as a result of COVID spread. For ICU capacity, we look at the overall ICU capacity and ICU ventilator beds. While there is no established threshold, overall we are aiming to be less than 50% of the overall ICU beds capacity. Higher than this may result in a stress to the healthcare system if COVID-19 cases increase in Windsor-Essex and if any of them requires more intensive care. So looking at where we are with all these cases, we crossed 1,100 cases mark in our region. Approximately 60% of our cases are resolved. 31% are still self-isolating, which is good news. Unfortunately, we lost 6% of our cases. Less than 1% of the cases are currently in the hospital or ICU settings. Some of these cases are self-isolating that may have been admitted to the hospital initially, but discharged when they did not need medical care. Please note that this does not include individuals who are at the field hospital. Looking further at the age and sex breakdown of COVID-19, because we lost 6% of our cases to COVID-19, overall more female died as a result of COVID diagnosis, with COVID diagnosis compared to male. From an age distribution perspective, almost 70% of the cases were an individual who were 80 years and older. The youngest person died in our region was a man in his 20s. This particular graph shows that what it means for an individual who contracts COVID-19 and the case fatality rate in our region compared to the provincial average, and further breaking it down into the long-term care home and community. What we can see in our community that the overall case fatality rate has declined to 6%, which is a decrease from last week. And those who are living in the long-term care home and retirement home, case fatality is significantly high, which is 16.4% in this age group. As of June 10th, the case fatality rate in all of Ontario is 7.9%, which is higher than what we are seeing in our community overall case. And in long-term care home across the Ontario, the case fatality rate is also higher compared to Windsor and Essex. So in Ontario, we can see the 22.1% case fatality rate, and in Windsor and Essex, it's 16.4%. So that's one of the figure that I would like to highlight as a result of random testing in Windsor and Essex. One word of caution that I would note, and it's in the bottom, to note that we do not have the full results for LaSalle and all results for Leamington. But for the rest of the region, this is what it looks like. Among the tests that was done through the drive-through testing model, we reached out to almost 4,500 individuals across Windsor and Essex. We have received more than 90% of these results already. And among what we have seen, we have only found 4 individuals who came back positive, which is a good sign, which essentially means that when we are talking about what the current situation in the community looks like, so far to date, we only have found 4 positive cases as a result of this drive-through testing. The doubling time tells us how many days it will take to see twice as many COVID-19 cases in our region. This is a cumulative comparison, and what we can see that the doubling rate since our first case was reported, we are well past 5 days considering in late March and April, and when we were doubling every 2 days. So this is also showing the impact of flattening of the curve in our region. The general direction, looking at day-to-day comparison, is overall we're moving in the right direction. We have seen some variability lately in Ontario as well as in Windsor and Essex. In Windsor and Essex, we dropped down, which means that we were doubling at a higher rate on a day-to-day comparison, and mainly resulting from the cases in the Agri farm industry in the last few days. The most recent estimated mean R0, which is the reproductive rate of transmission, so essentially meaning, in simple terms, if we have a case, how many individuals or how many new cases that single person can generate. And it varies, and it basically is a result of combination of the measures that are currently in place, and it's not an absolute measure to say what exactly will happen. So that's why we're using the terminology effective reproduction rate or effective mean R0. When the R0 is greater than 1, which it's mean that each infection will cause more infection, and then overall, if that trend continues, we will continue to see an increase in the cases in the community. When R0 decrease to less than 1, that means a new case is not generating enough cases, and then eventually if that trends continue, we will continue to see a decline in the mean reproductive rate, and that means the case count will eventually go down to 0 in our community. So in summary, what we can say is we have seen a higher number of cases more recently in the last week, mainly attributed to the agri-farm sector. Windsor-Essex has the 4th highest rate in the province, and the primary source of exposure in the last almost 2 months is due to close contact with a confirmed case. The health system capacity and the health system is mainly protected with the ICU capacity, and the health hospitalization capacity is within the expected thresholds. Random testing so far has yielded only very few positive cases. And R naught effective value is at this point is higher, is greater than 1, signaling an increase in the spread of COVID-19. But we're expecting that number will go down as we get a better handle and have immediately reached out to all these contacts in this agri-farm sector to prevent further transmission. Thank you.
Conference is now unmuted.
We'll now take questions from the media. We'll start with AMA 100.
Yes, going back to what you were saying, Dr. Ahmed, about reporting of workplaces, I don't know if I was the only one under the impression that you were going to name the actual businesses. So what you're saying now is that you're not going to name the businesses, you are going to just name the sector that they're in?
There will be a need to share the name of the business. Yes, we will share that name, but again, those decisions are based on the risk to public, and also if that business is particularly entertaining or the community members. If there's a risk to the public, so say, for example, if a business is not open for the general public to go in and do any business there, so potentially that eliminates the risk of individuals or the community with that particular business. So we will not be naming those business unless we feel that there's an urgency and there's a need for the public to know. So we will disclose that. And for the businesses, or for example, if there's a grocery stores or there's a place where many people visit, and if there's any concerns about cases in that particular business and has an implication for the community, we will be naming those businesses particularly, but the businesses that are not currently at a risk of public accessing those businesses may not necessarily be disclosed unless it meets the need for public health reasons to disclose those names.
Okay, so for example, maybe like a massage place or like a physio clinic or something like that the public aren't just constantly going in and out of?
That is correct. Yeah, so those places when people are going, and if we have a reason to believe that any transmission or any risk to the public, so those businesses can be identified. But for the places which is not necessarily open to public, no one is going in and out, those places may not necessarily be identified. But as a sector, for disclosure, we will identify the number of outbreak or active cases that are happening in those regions, in those sectors.
Okay, so is that different from what you announced earlier this week, just based on discussions, or was that always the case?
Well, it's not different. I think it's just expanding on what we already reported and weighing in all the evidence and all the benefits, because we obviously, as we said, that with this pandemic, we do not want to create more problems by answering these questions. So the focus has always been to protect the health of the public and ensuring that if the community is at risk, we will take actions to mitigate those risks. So right now, we don't see that it's just the expansion of what we originally identified.
Okay, and when can the public expect to see that list up on the website? So
that list is currently, and we said that this will come in this week. So my hope is it will be up before even noon today.
Okay, thank you.
Any questions from Windsor?
With the plan to only hold these live briefings every Friday, a lot of people on Facebook, actually in large numbers, have asked if the health unit could start providing the daily number of cases broken down by agri-farms or community transition or close contact, if they could provide that daily on the website. Is that something you could possibly do?
We can definitely look into it, that if we can provide that information. We will just have to find ways to do that. So we can definitely take a look.
Any questions from the Windsor Star?
How many people do you think will be tested randomly for the last day of random testing today?
So I think the test was in Leamington yesterday, and we tested close to like. will be tested today. Well, that's a guess. I cannot say how many people will end up testing. So it really depends on who shows up. But we're hoping that in previous places we received a good response, and we're hoping that we'll receive a good response today as well.
Thanks. Any questions from CBC?
Yes, good morning. Dr. Ahmed, a lot of our neighboring communities entering phase 2 today. What do you need to see in Windsor before you are confident we are, able to move into that second phase of reopening?
So one of the significant driver of this decision is the number of cases and how it's spreading in our community. So obviously, we have seen an increase in the number of cases, absolute number of cases in our community in the last week. We were moving in the right direction. So once we know what is happening with the number of cases and if we can bring it down to a reasonable level, the second question of interest would be how these transmissions are happening. And if we are seeing a more than or unusual number of community transmission, which means that people are still contracting or maybe not following some of those recommendations and potentially infecting other people, that will be something that we'll be looking out for. And all those numbers are currently being tracked and reported to the province for their consideration for when they're making those decisions to help the regions open up.
Thank you. And with the drive-through, the random testing sites wrapping up this week and some positive results there, it sounds like, what would be the next step? Would you consider doing this again to kind of take that temperature of, getting some insights on how it's tracking in the community?
That's a good question. And public health, every time when we are looking at the need of the community, we definitely look at that, and also the resource that it needs to do that kind of work. So obviously we are always open to it. We never, public health was never in the lead to do these type of testing, but when we realized that this is the need in the community, we did expanded that testing based on the need of the community, and we'll continue to look at it. If it's needed, if it's beneficial for the community, we may consider it again.
Do you think that it's an effective way to track the spread in the community?
Well, this is definitely an effective way to reach out to people and make it easy for to get a sense of what is happening in each of these communities when we are removing some of the other barriers and trying to get a sense of some kind of a randomness in the community. So it's definitely a good tool. We'll just have to be a little bit more creative in how we can continue to track similar data from the community to help us make evidence-informed decision making.
Thank you.
Any questions from Blackburn?
Yes. So going back to the random testing, I mean, with only so little cases that have come back positive, I think it is a good use of resources to. I mean, I don't know. I just think would that be something you consider doing again with the amount of cases that came back negative so far?
Just like I answered before, that it all depends on the needs of the community and also the resource availability and the potential utility for that, and that changes every time. So the need of the community may be very different from what we will see in the month from now or weeks from now. So it changes all the time, and that's why public health, we always try to use the evidence that we have right now to make decisions that would help us move forward with the measures that could be beneficial for the community and help to protect the spread, to prevent the spread of the COVID-19 in our community.
Was the attendance at the assessment centers down while you were going throughout the community?
So I don't have those numbers in front of me, but I think those numbers, we know that Assessment Center expanded their hours of operation, but now they have gone back to their regular hours. So I can conclude that maybe they're seeing some changes at the Assessment Center as well. But again, I don't have those data right in front of me to see whether their numbers are going down or not.
And about the disclosures, I understand why it wouldn't be necessary to share
for if the public is not really entering these businesses, but do the businesses themselves have the responsibility to disclose to their employees that there has been some evidence of transmission within their facility? Is that something, would that kind of notification go out from the business or from the health unit, even within the employees themselves?
So definitely not from the health unit. Many of these businesses are obligated under the occupational health and safety regulations and under the Ministry of Labor regulations to provide some of that details to their employees. But that's to their employees, and many of the businesses, I think they made a responsible decision at times to disclose it even to the general public. So I think it really depends on these businesses and their decision making. From a public health perspective, we always try to focus more on the relevance and the protecting the community. So that is always on our forefront. Any decisions that we are making, whether it's required or not required, is always goes back to protecting the public. If the risk is there for the public, we go ahead and we make those decisions. But for the rest of the industry, they follow the guidelines that is set by the Occupational Health and Safety, Ministry of Labor, and some do more than what they're originally expected to do.
Okay. And last one, has any more work been done on the daycare front? Have you heard more from the province, and where is that process right now?
So those details are currently being looked at at all the centers in the region, and also with our team, who are getting some of those requests for information and clarification. So our team is working with many of these facilities to provide guidance to them.
You haven't approved any more openings at this point?
We're still looking for some more guidance in terms of the approval. To our understanding, it's not necessarily they need the approval from the medical officer of health, local medical officer of health. Definitely a direction. Some of the directions are coming from the chief medical officer of health for the province, but we definitely work with many of these daycare operators to ensure that they are safely operating based on the guidance that is currently available, and also looking at their unique circumstances. So we do not feel at this point that they necessarily need my permission. They need some directions from the chief medical officer of health. But as the community, we are looking at all of these questions, recommendations to ensure that these operations are safely run.
Thank you.
Any questions from CTV?
Yeah, I'm just curious, are you at liberty to share the spread of the 4 positive cases that you got? Like, was it in one certain area of the county, or was it evenly spread out across the test sites?
So that number is there in our slide. So in Windsor test site, and this is not looking at the actual location of these cases, at the Windsor test site, no one was positive. At the Tecumseh test site, we had one person who was positive, and in Essex site, we had two people who were positive. And in Kingsville, we had one person who was positive. So that's the total of 4 numbers that we have seen. And we'll do further analysis, sub-analysis next week when we have more information from these cases. And that would help us understand more. But as of today, we have received only 4 positive cases in total through this drive-through testing.
Okay, I know you're happy with the low amount, only 4, but what's the overall picture for you? What does that tell you?
Well, that definitely tells me that in terms of when we are looking at in the community, most of the community members who are accessing those test sites, and the randomness or the selection of these is to try and maximize and make it easy for anyone to go in and get tested, and when we're using that approach, the understanding is anyone can go in and get tested because we've made it easy for them, and have a sense of true spread of the disease. So if people who are doing regular people, average people, not necessarily people who are overly conscious about their health, or people who are totally don't care about their health. So we are trying to look at like the in the middle of who what the normal behavior should look like, and based on that, if we're getting 4 cases, I think that's a good sign, because that means that truly we do not have that many active cases in the community who are spreading it. So the key message still is, if we continue to maintain and do everything that we are doing, we will be able to get rid of all these cases and the spread in the community. Some industries, some sector will continue to be vulnerable, because some of those changes are not anything that can happen in the short time period. It definitely requires a lot of long-term measures. What we are seeing in the agriculture farm industry is not something that that someone can say that could have done, should have done to prevent this from happening. The pandemic, it's spreading everywhere, and there are some population that are more vulnerable than other. The shared accommodation of all these farm workers are putting them at a high risk, and that's where we're seeing that. So with all the efforts and the work that's been the health unit staff, the ministries, and different sectors have been doing with these farm industries, are still able to contain it in a better way, given what the potential could have been. So I think it's important that we shouldn't think that what we are seeing is completely unexpected or completely preventable. It's just a function of it. So I think maybe when we are past that period, we'll be looking back at it, and the appropriate level of government, whose different roles and responsibility when it comes to these temporary foreign workers, how they're housing, and what regulations are currently in place, maybe they will be looking at it, at how they can make it better. So we will be, from a public health side, we'll be providing some of our thoughts too, that how we can make this situation better.